Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Patrick Archambeault with the Eddy Visiting Nurse Association program and Kathy Leonard, manager of the Eddy Lifeline Program. Thanks for coming in.
Thanks for inviting us.
Patrick, why don't you start? What do you do for the Eddy Visiting Nurse Association?
I am the Director of Clinical Specialties, which means that I oversee the infusion therapy program, the infection control program, and our chronic care program.
Wow,
Yeah.
That's a lot of work, huh?
Yeah, it sure is.
And Kathy, what do you do for Eddy Lifeline Program?
I have the good fortune of managing the Lifeline Program, and with that comes our medication dispensers right now.
Wow, lots of stuff.
Lots of stuff.
So, Patrick, can we start with talking about really what is home care nowadays? Does it really range many different topics that are covered there?
Yeah, home care has come a long way. Eddy VNA has been doing this for over 100 years. And when we started this program years ago, it was just nursing taking care of patients in their home. And we've expanded since then to include physical therapy, occupational therapy, speech therapy. We have several specialty programs. We have clinical nurse specialists. We have certified diabetic educators. We do specialized wound care treatments, and we have the Tele-Home Care program.
Okay, so everyone sort of makes their appointments, and somehow they have, how does it work? They have a doctor telling them this is what you need
Pretty
this
much.
often, and then it's scheduled?
We have liaison nurses that work for Eddy Visiting Nurses but are stationed in the hospitals, and patients who are being discharged are referred to the liaison to see if the patient's appropriate for home care services. And then a referral is made to the home care agency, and yes, physician's order is required for services. And then we schedule a visit when the patient's discharged from the hospital.
Okay. And then what are some of the specific tasks that these workers can do?
They can really provide almost the same level of service that the patient would get in the hospital. For example, if the patient has a complicated wound that requires a special procedure, we can do that right in the home. We have specialized wound care products to heal wounds quicker. We have things like wound vacs that will actually help heal the wound quicker. If the patient's getting infusion therapy in the hospital, we can do that right at home. And then physical assessment, just to pick up on subtle changes in the patient's condition so we can intervene before the patient has an exacerbation of the disease, which forces them back to the hospital.
So generally, a patient can, let's say, have their heart monitored as well as IV fluids.
Absolutely. Vital signs are very important. Blood pressure, pulse, respirations, lung status. We have a lot of patients come home with respiratory illness, and we do a lot of teaching. So not only the hands-on skill that we do, but we also do a lot of teach back with the patient to let them be in control of their disease so they know how to handle symptom changes before it ends them back up in the hospital.
And I hear that happens frequently, that someone, once they're admitted to the hospital, is it 1 in 3? Is readmitted?
1 in 5
1 in
patients
5?
With chronic care conditions are readmitted to the hospital, and you know that's a huge cost for healthcare dollars. And so we're looking at teaching the patient by increasing their confidence and their ability to maintain their disease at home, to learn about different techniques that they should do daily to keep themselves healthy.
And what do you think is the reason behind the readmission? Are they not following the medication protocol, or what else would
That's
it be?
a very good point. The majority of patients who go back in the hospital within 30 days from their acute care discharge is because of medication reconciliation issues. When they come home, they're given several new scripts to fill. They're not sure what those medications do, and some of them say, if I don't know what it does, I'm not going to take it, or maybe the co-payments are too expensive, and they don't realize the importance the medication has in managing their disease. So our nurses will put that medication through a drug utilization review to look for drug interactions and to make sure the patient understands why they're on the medication, why they need to take it on a regular basis, and how it works.
I did one of the Focus on Health shows on asthma, and one of the things the doctor said was it's very common for them to have flare-ups because they feel if they're not having symptoms of whatever the disorder is that they don't have to take their medicine. But that's not true, right?
No, it's absolutely not true. Patients think that they were on the medication, they're feeling better, so why do they have to continue to take it? And we want them to understand that the reason they're feeling better is because they're taking their medication. So stopping it is not a good health choice.
Even if there are side effects. Because
If there are-
sometimes that's the reason that
Yeah,
they don't want to take
right.
it. because of
And
the
so
side effects.
we want to know what these side effects are. Some side effects we can control. So for example, if a patient's on an antibiotic and they're feeling nauseated or they have some kind of GI symptom, we can work around that by, having them take the medication with food or take the medication without food. It really depends on the antibiotic. So if our patients tell us what the symptoms are, we can usually work around that.
And then there's also the other phenomenon that I see as a consumer health librarian is if there isn't any follow-up, I think a lot of times patients feel like they're kind of all alone once they get out of the hospital.
Yeah.
And they say, well, Peggy, can you research this for me because I don't want to bother the doctor because I'm feeling this certain way. Is there an interaction? And the first thing I say is, can you please just call your doctor's office? They need to know what's going on.
Yeah. And patients do feel alone when they get home, and that's why we want to encourage them to accept home care services and explain to them that what we're going to do is work very hard to keep you home and keep you safe. So we do a lot of teaching with them to keep them from going back to the hospital.
That's very good. Okay, Kathy, the Lifeline Program, do you want to explain what that is?
I want to segue off something Patrick just said, actually.
Okay.
When he said people feel very much alone at home. And I think when people feel alone, they might feel afraid. So therefore, if you have a Lifeline at home, they won't have to be alone.
Okay.
Okay, so let me tell you how the Lifeline works. Most people view Lifeline as a safety net. It can be a safety net for certainly the person who has the Lifeline at home, and it's also peace of mind for the family members who worry about the person who might be recovering from surgery, who might just be scared, who might not feel well. So how we work Lifeline is all we need is two things in the home. We need an active telephone line. And so many people right now are going with cell phones instead of, we still need a landline in the house.
Oh.
Okay?
Okay.
Now, everyone's working towards something, but right now we need an active phone line and an electrical outlet. And what we do is we plug the Lifeline into the telephone jack. We plug their phone into the Lifeline. We have a battery backup. So if people lose power, we have 14 hours to 16 hours available on the battery backup.
That's good.
It's very good. So how this works is, let's not take the typical scenario, help I fallen. Let's not do that.
I've
Let's
fallen and
talk-
I can't get up.
Yes. Let's just talk about someone who's just dizzy. Someone's in the bathroom, gets out of the shower, change in temperature, some steam, and all of a sudden, I'm a little dizzy.
Medication.
They hopefully are wearing their Lifeline button, because the Lifeline button, whether it's a necklace or a wristband, they have a choice. It's waterproof, so they should wear it in the shower. So if that person gets out of the shower and is dizzy, all they have to do is sit down, push their Lifeline button. Now what's going to happen are some sequential steps. Number one, you're going to hear, it's going to beep. And then you're going to hear a voice say, Peggy, this is Eddy Lifeline. Do you need help? Now, let's say you say, I'm just a little dizzy. I haven't fallen. I'm not sick. I'm a little dizzy, and I'm afraid to walk right now. Then the operator will say, all right, you have told us, as a first responder, call my husband. Is he available? Yes. All right, then they're going to call the husband. But what they're going to do, they keep you on the line. They're not going to hang up on you. They're just going to say, stay right there. They put you on hold. They call your husband.
Now, is it that device?
This is one of the buttons.
Oh,
This is a button
Okay.
that they have a choice to wear.
but what's talking? Is that talking?
This is the sound, the voice comes out of here.
Oh, okay.
This
Thank
is
you.
actually, you're welcome. This is called a monitor.
Okay.
Looks like a baby monitor, but this is the monitor. Okay, it's Lifeline Monitor, and the sound comes right out of here.
Okay.
Okay? So then the lady or a man will come back over the speaker there and say, Peggy, your husband's on his way. The beauty of this is, Peggy, if the person sounds nervous, that operator will stay on the phone with you until the person arrives, just to
Okay.
keep you calm. And then, let's say you don't respond though. Let's say you push the button, the operator comes on and says, Peggy, this is Eddy Lifeline, do you need help? Nothing. That's called no voice response. So since there was no voice at the other end, they will call the first responder and say, I just called your mother, your aunt, your uncle, there's no response. Do you know anything about where she might be or what's going on? No. I'll call the paramedics, the operator, and then usually the first person says, we'll meet them there. So they take action right away.
Okay.
Okay?
And what other kinds of devices do you have? What is auto alert?
Let's talk about auto alert. Many times, I've done this a little over 20 years. And for 19 of these years, people have said to me, I pay a monthly fee. But what if my mother falls, hits her head, and is not able to push her button? Why am I paying a monthly fee?
Right.
Up until a year ago, year and a half ago, it's a very good question. However, Philips has come out with this button. It's called Auto Alert. It just looks just like this, okay? And if you think of the name Auto Alert, if a person is standing and takes a vertical fall and is knocked out or is disoriented and confused and genuinely just doesn't know what to do, doesn't have the strength, if that person is not standing in 30 seconds, which is not a long time, that button, remember, Auto Alert, automatically alerts the emergency response system. Their response is different, though, to you. Because when they called you, they said, Peggy, this is Eddy Lifeline, do you need help? Not so this time. They know you took a fall because it's the Auto Alert button, and it registers differently on the screen in front of them. So this is how they answer you with an Auto Alert. Peggy, this is Eddy Lifeline. We know you just took a fall. How can we help you? So it's different. It's different. It's powerful. Is it for someone who just slides off a chair? Absolutely no. No. It's got to be a vertical fall. But it also functions just like a regular Lifeline button. Wristband, necklace, it works the same.
So that has a base as well? Does
Nope,
it have
just
one
like
of those?
this. This works with this.
Okay.
This button functions with that Lifeline.
Okay.
Okay.
So they can't use it outside of the house?
They can use it 500 feet.
Okay.
So, for example, let's say
Shoveling.
shoveling, going to the
Shoveling's
mailbox, gardening in the front, works fine. Works fine. No problem. Now, let's take someone who might be a little hard of hearing, okay? Or let's take someone who has a large backyard and likes to garden and is not going to take no for an answer. We have another device that coincides with this. It complements it. It's called a voice extender. Looks just like this, but what it does is magnifies the sound coming out of the Lifeline. So where we put them in the summer, back porches. So people who
Right.
are gardening, okay, whether it's in the front or the back, we can put one out there as long as there's a telephone jack and electrical outlet. We can plug it in, okay? They push their button, and it will still actify the main console, but sometimes people won't hear that if they're outside. It's going to activate it, no problem, but they like to hear it. So what we do many times is we'll put the voice extender on the front porch where they're gardening, and then they'll hear the voice. And that gives them a sense of security, that they heard the voice saying, Peggy, do you need help? So.
Right. Now, I have a question. This base, can there be more than one in the house? If there are 2 floors or something?
Don't really
like
need
that?
it, to be honest.
Oh.
500 feet will go vertically and horizontally.
Okay.
Okay, so I've put them in Victorian homes, and up and down, it works. It works. Now, for some people who might want to, we put one in about a year ago for a 91-year-old woman who has a beautiful Victorian home. She walks on her treadmill every morning down cellar when she does the laundry. Now, we put a voice extender down there because she gets sometimes a little concerned, she said. She's never nervous, but she got a little concerned. So we put a voice extender down there. Not a problem. Not a problem. So it will work. Now, when our installers go out to the home, they do something called a range test. They set everything up, and then they do the commercial they do the commercial, can you hear me now, can you hear me now? They'll press it and arrange. They'll walk around and they ask the person, can we go here, can we go there? Where do you spend most of your time? How far do you go outside? And they walk there and they push it and they show the person the range they have with the Lifeline. 500 feet's a good distance. It's a good distance.
So what happens if there's somebody else in the house that's using the telephone? When
It
they
automatically,
call?
it takes over. It seizes the line. That's a good question. But when you push that Lifeline button, it seizes the telephone line, goes right through.
That's good to know.
Because sometimes someone could be on the telephone in another part of the house, and if you fall over here, they're not going to know it. They might not hear you fall, they might not see you fall, but when they push that button, that's disconnected, this goes right through.
Very nice. So let's talk about the automated medication dispenser.
Okay.
How does
I happen
that
to have one
work?
here.
You got all the gadgets
I
today.
am the gadget person. But again, to segue something Patrick said, and you asked the question, why are people readmitted to the hospital? They don't want to go back to the hospital. Think of the Wizard of Oz for a minute. There's no place like home. That's why home care is so successful now. That's why, these people do such a good job. They make people comfortable. They make people safe and healthy at home. This gadget, medication dispenser, actually helps people not be readmitted to the hospital. What we have here, there are 10 vertical cylinders in this machine. We can load 60 of these cups. Now, this is a medication cup that nurses would use in the hospital. And you can say, oh, it's not that large. I was experimenting once with my father's pills. I had 22 pills in here.
Wow.
And there was room to go. Well, you think of the size of pills. Some are large, some are small. It varies. But I had 22 in here, and we could have gone a couple more. Okay? So if you do 60, and again, it's a Tupperware snap, you load them upside down. The machine tells you how to load it. And we have this old-fashioned Chinese checkerboard that helps people load the machine. So when we load it, if you're loading just, let's say, 2 weeks, because you could really load a month if you take pills twice a day.
Right.
Okay? So to help people, we just put them right across the board. Now, let me tell you what the town of Colonie paramedics taught me. I was at their training a year ago. I was one of their speakers. And I showed this. They loved it, except they suggested, and we follow this now because of the Colonie EMTs and paramedics, they suggested for us to get a Sharpie and write on top of the cup here, Monday AM and then Monday PM. Because if you have an emergency and you have to pack up and take these out, and all of a sudden you have all these cups on the table, and you don't know which is AM, PM, Monday, Tuesday, now you have a mess. So this board allows you to do your routine, but the Sharpie, as suggested, helps you in an emergency. So it helps. It's, who can load it? Well, you can have a visiting nurse come over, a spouse, an adult child. We do not encourage the patient to load it. There's two keys. We usually encourage, if it's a nurse, the nurse to keep one, and then a family member to have one. You can do, however, let's say someone is taking medications at 9 o'clock in the morning and 9 o'clock at night, okay? At 9 o'clock in the morning, a voice is going to sound.
Oh, okay.
And the lights are going to flash, and the voice will say, time to take your medicine. Now, we have two kinds of patients. Patrick will smile. We have compliant patients.
Non-compliant.
We have non-compliant patients.
Right.
However, they want to be home. So the compliant person is going to get up, go over to the machine, and all he or she has to do is push the button, and this cup will come right down this chute. It won't fall. It catches it, though. It's nice. It catches the top.
Okay.
So they come over. If they have water there, they take the water with the pills, and they're done until the next time they take it. Now, let's talk about the person who either was in the shower when it went off, fell back asleep, TV's on too loud, or just says, I'm not taking those this morning. Okay? Now the machine's going to get even with them. The machine's going to talk to them for 45 minutes, every minute for 45 minutes.
Oh.
Time to take your medicine. Time to take your medicine. Now after 45 minutes, if the person hasn't pushed that button, an automated call goes to the caregiver's cell phone and says,
Oh.
the patient is in danger of missing the medicine. Didn't say missed it, because they haven't missed it totally yet. So we give them another 45 minutes. Lights flashing, they still have 45 minutes to take it. Hopefully then the caregiver calls and says, you got to take your medicine. But after 90 minutes now, if they still haven't taken it, two things will happen. Number one, the caregiver gets a second call to the cell phone, and the message is the patient missed the medicine. However, safety feature. Then what this machine's going to do, the cylinder is going to rotate. In the back here is a locked chamber. The cylinder rotates, and it deposits the cup that's inside that should have been dispensed into the locked chamber, such that at 9 o'clock at night, they get their night meds instead of their morning meds. So it's a safety feature. So it helps people take their medicine. People who just always forgot or genuinely just couldn't remember, it's just a gentle reminder. And I think by calling the caregivers on the cell phone, they then get involved, and the person gets his medicine or her medicine, and then Patrick's people are happy because they're not going back into the hospital. They can stay home. They can get their care at home, which is what we all want.
Right. Now, can this be used for more than one person at once?
That's a good question. No.
Okay.
However, we can have two in a home at once. We've done that. Now you might say, but how can you tell them apart? Well, we've only done it once. I was at the home and I said, oh, tell me what you like. And the man said, I love the Yankees. I said, all right. So I got a Yankee sticker, and I put a Yankee sticker on the front of his. And I asked her what she liked. She liked flowers, so we put flowers on the front of hers. So that way they knew which is which. And we put it, they weren't next to each other, but they were at a distance. That way they wouldn't get confused. And they never did. Never got confused. Never got confused.
That would be another reason to Sharpie label
Yes.
the top.
Yes.
Especially if the two of them are coming out at the same time.
Yes. I do think it's important that people understand with a medication dispenser and a Lifeline, it doesn't have to be for a lifetime. Like so many people are afraid to get a Lifeline because they're afraid, I don't want people to know. If you're recovering, Peggy, from surgery, back surgery, hip, knee, sometimes you go to rehab, sometimes you don't. Sometimes you get your rehab for Patrick's people at home.
At home.
Right?
Yep.
So therefore, this physical therapist leaves, the occupational therapist comes in sometimes, she leaves, and now, as Patrick said, now you're alone. And it's one of these, now what?
Uh-oh.
Yeah, now what? I'm afraid to move, I'm afraid I might fall. Again, Lifeline gives you just that little safety net, little bit of confidence but I'm okay. Wear the button, be careful, but know that, I'll give you a couple quotes from some patients. One lady said to me, it's like a guardian angel, always in the room. Someone else said to me last week saying, it's just a voice. It's a voice for help. And I think that was a nice phrase. She fell, the voice came over there, got her help. So I think once people have used it, they realize it's worth. So if you have surgery, you're recovering, you're home for rehab, you don't need it forever. Use it as long as you need it, and then we'll come get it. No problem.
Well, you never know what's going to happen from day to day.
You don't.
April 23rd of last year, my husband had a good hip. April 24th of last year, he fractured his pelvis playing soccer. And we had an 11-month-old at home, so it was quite interesting where life takes you.
It is,
All right.
and that's why I like the phrase, don't let an accident turn into a tragedy. We all have accidents. We're all human. But we need to have things in place so that accident doesn't become a tragedy. And with Lifeline, it won't be a tragedy.
Okay, let's get rid of the medication dispenser. And then you can tell me about Tele-Home Care, please.
Okay. Well, I'll start, and Patrick, you chime in on this?
Yeah.
Tele-Home Care is 2 or 3, 4 pieces. We will go to someone's home, and we bring a scale, and we bring a monitor, not a little different size than the Lifeline, but a monitor. We bring a blood pressure cup, an oximetry. Is that right?
Oximeter.
Yep. And what's nice is the person on a regular basis each day will transmit his or her vital signs right to Eddy VNA. And with the nurse reading these signs, they know immediately, even a weight gain. I thought that was interesting. I was reading on that last night. A sudden weight gain from the day before, there's an indication that something's wrong. So they know right away something's up, and they'll call, and they'll talk to the person. And then they might say, maybe we need to call the doctor, maybe we need to visit, let me call for you. They might send a nurse over. But it's sending that vital medical information right to our office so we can monitor them and keep them safe at home. They don't have to go out in the cold. They don't have to get dressed.
Right.
They just have to stand on the scale. We teach them how to do the blood pressure cuff. Sometimes people get a little nervous about that initially, but our installers just show them. They do it on themselves first. Then they put it on them. They teach them how to do it. They stay until the person's comfortable doing it. And it's like anything. Once you do it once, once you do it twice, it's routine.
Okay, so they weigh themselves. All right, and then how long would the heart monitor, is it the heart monitor on all the time?
No, the heart monitor is not on all the time. It's transmitted like a Lifeline over the telephone. And it goes right into Monique's office, correct?
Yeah, we ask the patient to once a day and at the same time each day to take their blood pressure, to put the pulse oximeter on their finger so we can check their O2 saturations, and also to step on the scale so we can get their weights. And it will be transmitted to our nurses unit in the office, and it will alert. So if the patient has had a significant change from the day before, it'll tell us, and then we will call the patient, have them retest, or send a nurse out, like Kathy said, or contact the physician.
That sounds very nice.
Yeah.
Now, you guys, Patrick, did a study on Tele-Home Care intervention. Do you want to talk about those results?
We did a study for Tele-Home Care, on Tele-Home Care for patients with chronic care conditions, and we looked at diagnoses like heart failure, chronic obstructive pulmonary disease, diabetes, and coronary artery disease. And we picked a group of patients to install the Tele-Home Care unit in their homes and have them use them. And what we saw after a year's time was a 55% reduction in hospital readmissions on that group of patients. We saw a 29% reduction in emergency room visits, and we saw a 42% reduction in overall healthcare costs for those patients. So it's hugely successful. And so it works, and we know it works, and we believe in it, and we want more patients to use this equipment.
That's very impressive.
Yeah.
Can you please tell me, Patrick, about the Eddy Transitions Coach Team? What is that?
Sure. That's our newest initiative. We started it back in 2009, and it's based on Dr. Eric Coleman's transitional care model. And what Dr. Coleman believes is, as patients transition from healthcare facility to healthcare facility and through practitioner to practitioner, that there's a certain level of danger in that, and that not all of the information that needs to be transmitted with that patient goes. So we have transitional care nurses who are specifically trained in Dr. Coleman's model, who will follow the patient in the hospital, introduce the program, and then see the patient at home within 24 to 48 hours of their acute care discharge. And they focus on 4 pillars, and the first pillar is medication management. We know that
That's important.
yeah, we know that that's one of the key indicators, and patients who don't know how to take their medications won't do it correctly. So we'll sit with them and we'll, again, make sure their drugs don't interact with each other. We'll make sure they're not taking the same medication under 2 different names and then double dosing themselves. And we'll make sure that they have access to their medications. The other pillar is to give them a personal health record, and we ask them to fill it out and to keep it updated. And it's basically a it's a mini medical record, and we ask them to bring that record with them to all of their healthcare appointments.
That's excellent.
So all the information is there, it's current, and the physician is getting the full story before they make any changes. The third pillar is to make sure that the patient has a follow-up physician's appointment within 7 days of acute care discharge. We know when that patient first comes home, there's a lot of questions, a lot of confusion,
Yeah.
and if they don't follow up with their primary care physician within that first week, the chance of them being rehospitalized increases. So we make sure that that appointment is made and secured, and they actually go to that appointment. And then the fourth pillar is to give them disease management support tools, things like scales. If they have a respiratory illness, we want to give them incentive spirometers to keep their lungs healthy. We give them zone tools. The zone tools are set up like a stoplight. Green means go, and it means that, you know, if you're in the green zone, your symptoms are in the green zone, you're doing very well managing your disease at home, your illness at home, and we want you to stay there. And so if they start to have symptoms that creep into the yellow zone, that's the cautionary zone, and that's where we want you to notify your healthcare practitioner, your physician, your home care nurse, or your coach, so we can intervene right there and make changes so you can stay home and you don't have that exacerbation. The red zone is when you cross over into a critical situation where you have to go to the emergency room. So we're trying to prevent that step, that rehospitalization. So.
Wow, that's great. Now, who can talk about the expected growth in home care jobs? They're forecasting 48% growth by 2018.
Yeah, home care is a very popular, growing industry, and the goal is to reduce hospitalizations. Patients who are immunocompromised, the hospital is not the best place for them to be, because there's certain things that happen in hospitals, like nosocomial infections, where the patient can get sicker. So there's a need to go to the hospital when you're sick, so you can be stabilized, but then you should recover at home. And so we'll see more and more of those referrals coming to home care and more critical patients. So patients won't be sitting in the hospital. Their length of stay will be decreased because they'll have the home care services in place to get them back to baseline.
Okay, so let's just talk about some further information, a telephone number to contact the Eddy.
274-EDDY, E-D-D-Y.
Okay.
And I think that translates to 274-3339.
It does.
So yeah, that's the Eddy information line.
And then the web address.
It's www.anyhealth.com.
Okay. Thanks very much for coming in.
Thank you.
Thank you.
Thanks for watching. We hope to see you next time on Focus on Health.